If you guys want to see it later, it'll be on. But okay, so what we're gonna go over today is the anatomy of the heart. All right, so we're gonna go over two things. We're gonna go over the anatomy. So anatomy and the physiology. All right, for people that were here before, that have been here, Angel, what does anatomy mean to you? What's anatomy?
A piece or something?
A piece of something. Okay, that's close. Cindy, how about you? Okay, now, so anatomy, to keep it simple, are the parts. So the parts. Specifically, the organs. Okay? It's like, for example, the sweater I'm wearing. This is a heart. That's anatomy. Okay? That's a vessel. These are vessels. That's anatomy. Anatomy is just pointing to the parts and saying what they are. That's it. Okay? Like, for example, the anatomy of my watch, this is the glass. The hands, those are the little hands that move. This is the band. That's the anatomy of my watch. Just the parts to make the watch, like the parts to make you. The organs are the anatomy, the parts to make you. Any questions? No? Okay. Okay, can anybody remember what physiology means
How
then?
they work.
How they work. Exactly. So next to physiology, if you're taking notes, is put work or function, whichever one you remember better. So anatomy are the parts themselves. Physiology is how they all work together. So again, going back to my watch, the anatomy of my watch, the band, this is the band. That's the anatomy. Like I'm just pointing to parts and saying what they are. This is the glass, the cover. These are the hands that move, right? That's the anatomy. The inside, the gears inside, that's the anatomy, the individual gears. The physiology is how those gears work together to make the hands move, okay? So anatomy are the parts, physiology is how they work together to make the watch go round and round. So that's how the body is. Anatomy are the organs, physiology is how they work together. Any questions? Nope, all right. Pretty straightforward, right? All right, so what we're gonna go over is gonna be cardiac anatomy and physiology. I'm gonna go over how the heart works when it's normal, like under normal conditions, like when there's nothing wrong with it, okay? So first off, the heart, in case you guys forgot, for the ones that have been here, is made up of 4 compartments. There's 4 parts to the heart. There's 4 parts. Think of like a 4-bedroom house, okay? You got 2 little rooms and you got 2 big rooms. The little rooms are on top. The little rooms. The big rooms are in the bottom. Does anyone recall what the top rooms are called? The top chambers? What did you say? Atriums, good. The top rooms, the small rooms on the top, they have names, all right? Atriums. So we have one on this side, and we have one on this side. Atriums. Okay, the little rooms on top are called atriums. Who can remember what the big rooms in the bottom are called? Ventricles. Good. The bottom ones are called ventricles. Ventricle, and then this one's also a ventricle. So right now I said anatomy are the organs, right? Well, right now we're going over the anatomy of the heart. So the atriums are part of the anatomy. The ventricles are part of the anatomy because now we're going over the parts of the organ. What makes the organ? So atrium, ventricle, ventricle. That's it, it's easy. There's only 4 parts of the heart. It's too easy. Okay, there's 4 parts of the heart. Now there's gonna be one more note that the people that have been here should know, but everybody else, the other half kind of might not know. And that is when we're talking about a side, like let's say that Cindy got stabbed in her left shoulder, right? Let's say that Daisy is my doctor that I'm gonna turn over to. So me as an EMT or paramedic, I have to turn over this patient to my doctor, right? Well, if Cindy has a knife on her left shoulder, that's my right? But so the way I would say it and what I would say is that the knife is on the left hand side. What? I'm blind, I can't see that. Just tell me.
So you're saying, but on the notes.
Yeah. Oh yeah, it's on there. So whenever I'm talking about a side, like the side of injury, or like there's a scrape, or like something, illness, like an infection is an illness, I'm always going to talk about the patient side, not my side. So I'm not gonna say if the knife is stuck in her left shoulder, I'm not gonna say it's on the right hand side because it's on my right hand side. It's always the patient side. So, and that's gonna apply, I don't care if you're looking at a textbook or if you're talking about a patient in real life, it's always gonna be opposite because we're always pretending that we're looking at a patient, okay? So when you look at a textbook, any medical textbook, because if it's anatomy and physiology, it's gonna be medical, okay? So this, for the purpose of your job as an EMT, this is going to be the right because it's the patient's right. That makes sense? It's the patient's right, okay? This is now going to be the left, okay? So this is your left atrium, this is your right atrium, this is your left ventricle, and this is your right ventricle. And why is that again? Somebody tell me? Why is it gonna be opposite?
Because it's based on their body and not yours.
The patient's always, always, always. That's one thing that you have to, what I'm talking about right now are things that you're gonna have to know. Like bare minimum, even to be a firefighter, because most firefighters have to be at least an EMT. Okay, so you have to, like the bare minimum, just to have a conversation with the paramedic or with a doctor. You don't have to know this stuff deep, but you have to know enough to where, like, when I'm saying anatomy, okay, that means he's talking about an organ, right? If I'm talking about an injury on the side, obviously it has to be on the patient's side, right? You think that should just be automatic if you're working as an EMT or paramedic, all right? So I'm gonna put it right here. So side, from now on, sides are opposite. When talking about an illness or injury to a patient, okay? If I write it up here, it's absolutely like bare minimum things you have to know. And if you get it down now, when we start EMT, it'll be even easier, okay? So try to get these like little foundation things right now, the basic stuff right now. Okay. So let me do this now. Now I'm gonna erase some of this stuff because I need to make space. Okay, so now I'm gonna talk about how the blood flows in the heart, how it flows in and out of the heart. So right here on the right atrium, your patient's right, the right atrium, because your heart's right here. So this is the actual heart. On this side, you guys see these two vessels right here? The blue one coming from the bottom, the blue one coming from the top. So blood is going to be dumped into the right atrium from these two fat vessels. Two vessels meet at the atrium, okay? There we go. Okay, so these two vessels have a name. Okay, so blood comes down through here from the top of your body and from the bottom of your body, and that blood gets dumped into the right atrium. Okay, the top one, this one right here, is called the superior vena cava. I'm gonna write that up here. So this one is called the superior vena cava. That might be an E right there. Might not be. All right? And it's superior because all the blood coming from it into the atrium is coming from the superior part of your body, from the top part. Superior means on top. So it's superior vena cava because all the blood that's coming is coming from your head and your arms, and it's all dumping into here, into this part, into your right atrium. Okay? So all the blood that comes from the superior vena cava, I'm gonna put it up here. Blood comes from head and arms. Okay? Now the bottom one. This one is called the inferior vena cava. Okay, this one right here. Okay? And that one brings blood to your heart from your legs, stomach, and chest. So blood from here comes from your chest, stomach, and legs. Okay? Put it right here. Blood from chest, stomach, and legs. This blood is coming onto the right hand side. Think of it as used up blood. So I'm going to put used up blood. Why do you guys think I say is used up blood? What has been used up the body needs to stay alive?
Oxygen.
Oxygen. So this blood is coming back with little, very, very little oxygen, okay? That's why it's used up. So from here, it's gonna go through these little doors. We'll talk about those doors later. But it's gonna go down from the right atrium down to your right ventricle. Down to your right ventricle. Again, still it's used up blood. So this blood has to go somewhere to get oxygen from here. So it's like you have two pumps in one. You have the right side of the heart, that's one pump, and the left side is another pump. Okay? The right side pumps blood that has been used up. So it's used up all the oxygen. So if I need oxygen in this blood, Jesse, where's oxygen at? When I breathe in oxygen, where's it gonna be at right now? Lungs. So from here, where do you think it has to go then to pick up that oxygen? The lungs. So from here it goes to the lungs. No, it came here through the inferior vena cava, so that's how it got there, used up. But we're not gonna send it back to where it came from, right? So now we have to pick up the lungs, the O2, so it can be used up again. So from here, where are we going, Cindy? Where's the oxygen at?
Lungs.
Good, lungs. That's where the oxygen is at. Okay, so from here, again, it's used up blood. From the right ventricle, now we're gonna go to the lungs. I'm gonna draw the lungs up here. Okay, the lungs would normally be right here big, around the heart, but I'm just gonna make them small down here so you guys can, it'll make it easier for me to make it make sense. Okay, so from here, so I'm gonna take this out of here so we can see this better. Okay, so from here, the blood is gonna leave through a vessel, and is leaving the heart through a vessel, and this vessel is gonna branch off, and it's gonna branch off into both lungs. Okay? So the blood is being pushed out of the right ventricle now to go pick up that blood. Okay? It's gonna go pick up that oxygen, the oxygen. The blood is going from the right ventricle to the lungs, because right here is where we have all that oxygen in the lungs, right? So vessels will go here, it's gonna branch off. This vessel has a name. What's a different name for lungs? Starts with a P. Anybody recall it?
Home.
You're close. Poem what?
Pulmonary?
Pulmonary. Good. So that's another thing we have to write down. Side note, pulmonary is a fancy word for lungs. So the way I would write it down is I would put pulmonary equals lungs. Okay? And then also don't forget cardiac equals heart. It's just the medical way of saying it. Okay? So pulmonary means lungs. These are just like very basic things you need to know right now. Okay? Sides, pulmonary, cardiac, physiology, anatomy. Very basic stuff you have to know right now. Okay? To set up a decent foundation. Okay, so once the blood, now I'm gonna change it up for you guys. Once the blood has picked up the oxygen, now we're going back to the heart. But before we get there, let me change it up. Let me add one thing. So this vessel, where is it going to pick up the blood?
Lungs.
Lungs. And what's a different way of saying lungs?
Pulmonary.
Pulmonary. So because it's going to the pulmonary.
Pulmonary arteries.
Look at you. Yeah, good. Remember that. So it's pulmonary artery. Who remembers what artery means?
Pulling away from the blood.
Yes.
From the heart.
Yes, you got it. I know what you meant. Okay, so this is another note. Arteries and veins are directional terms, like left and right. Okay? So anytime I see artery after something, like pulmonary artery, right off the bat, I know that that blood that's in there, that's in that vessel, is going away from the heart. Going away from heart. And if that vessel has a vein after the name, like for example, after we pick up the oxygen in the lungs, vessels leave the lungs that carry that oxygen, and they meet together, and they both take all that blood back to your heart. But now we're going to the left side of the heart. Okay, now we're going to the left side. But this blood has a lot of oxygen, so now we're gonna push this blood to the body from the left side. That's why I say it's like 2 pumps in one. Okay, so now we have all this oxygen. And what do you guys think this vessel is called? It's coming from the lungs. It's coming from the lungs.
Pulmonary.
Pulmonary vein. Vein. So pulmonary vein. See, the same pulmonary, the word after it just tells you the direction the blood is going, either to or away from the heart. So pulmonary vein. Pulmonary vein. So your other side note over here under artery is veins or vein take blood to the heart. We're almost done with the anatomy and physiology. So the blood going through here, that's the physiology part. That's the movement. Physiology means actions. It's whatever's happening. Okay? Anatomy are the parts. So that's atrium, ventricle. pulmonary artery, pulmonary vein. That's the anatomy, me pointing and telling you what each one is. The physiology of this is that blood pumping through here, going through here, how it works together. Does that make sense or no? Okay, cool, awesome. All right, so from here, now we're gonna push the blood from here to the body. So this blood is gonna come back into your left atrium, all this oxygen, right? And then it's gonna go through a little door, we'll talk about that door later, to here. And now I'm gonna call this blood good blood because we have oxygen, so it's good blood. It's not used up blood. So I'm gonna put here good blood. Okay. So from here, from the left side, we have this big old fat vessel that leaves the left ventricle. And I'm gonna put it in black so it stands out. So it leaves the inside of the left ventricle. Okay. Comes from the inside of the left ventricle. And now all this blood is gonna be pushed out through here. And from here, it goes to the body. So to the body. This big old fat vessel is called the aorta. It's the biggest artery in the entire body. Aorta means big artery, okay? So it's the aorta. Okay, you guys see this right here? This right here on the sweater is the aorta. So it's leaving, and these that are branching up, these will come up and become my carotid arteries where you guys check the pulse, okay? And the rest of it will curve down and literally travel down my body. As it's traveling down my body, other vessels will stretch out from it to go to different parts of my body to feed my body. So it's like a big old highway, and then you got the off ramps going into streets where FedEx makes deliveries. The deliveries are oxygen. Okay, that's one way to think about it. Okay, now I'm gonna get into the video. How that guy had that chest pain. Okay, so for that, I'm gonna let you guys catch up a little bit, and then I'm gonna, no, actually I can do it from here. Let me just erase some stuff. Okay, erase this, erase this. You guys kind of got the concept. Okay, okay, so now, as the aorta is leaving, we got time? Yes. Because I want to show one more video before we leave. It's gonna tie all this in together. All right, as the aorta is leaving the heart, there's small vessels that branch off from it. And they literally just go over the heart. Like they go over the heart. Okay? We're almost done with the lecture. Okay? Write down the name for these vessels. So these vessels are called, put it all the way over here because I barely have them over here, are called coronary arteries. These are different because they're going away from the heart, but they're going right back on the heart. With these coronary arteries, this is how the heart itself gets fed oxygen, okay? So the coronary arteries feed the heart itself. With oxygen, with O2, okay? So literally, just imagine that this hand is a heart, okay? And this arm is the aorta that leaves from the inside of the ventricle, this arm, right? And my fingers are like the coronary arteries that go over the heart as the aorta is leaving, okay? And then as the aorta is leaving, blood is going out to the aorta. I put that thing there. It's going out to the aorta. But obviously, because blood is pumping out, it's going up, and it's also going here. Okay, Your other note, why these are so important, and this is where we tie in the video, is that whenever there's a heart attack, the problem is in the coronary arteries. That's a heart attack, okay? A heart attack, when there's a heart attack, the problem is in the coronary arteries. All right, problem is in the coronary arteries. And all that means is that there's a blockage. Okay, so if there's a blockage in one of these, that's the heart attack. That's a heart attack. Okay, so heart attack. So this should all be like one note right here. You guys should chunk this up into one side note. So, and then a heart attack, we know that if there's a heart attack, the problem is in these little arteries right here, right? That's the problem. What's really going on inside is it's a blockage. That's it. It's a blockage. Blockage in coronary artery. And then we kind of went over some of the drugs last time that they'll need, nitroglycerin and aspirin, right? So blockage in coronary. Okay, so if I have a blockage here, this coronary artery is gonna feed this part of the heart, right? But what if I have a blockage? What's gonna happen is the blood gonna go through there?
No, that part does.
No, right? So then if the blood's not getting through there, what's not getting through there? What does the blood carry that we care about?
Oxygen.
Oxygen. So now this part is gonna start to die. All right, and that's when they get chest pain. So this is why they get chest pain. Just how that patient up there in the TV, how he had that chest pain? The chest pain was because there was no oxygen getting to a part of the heart, so the heart was acting up. It acts up by showing pain. It's like if I were to not feed you for a month or give you water for a month, you're gonna start acting loopy and start acting up, right? It's just a normal thing. You're gonna start being delusional and not thinking right. Well, that's kind of what the heart's doing by giving you pain. It's not acting right because it's a part that's dying. That's literally
in the video,
dying.
it showed I want to say like a bump forming inside his vessel.
Yeah, and
What are
that's
those-
that blockage right there.
What exactly are they called? Like, how do you get those?
So you get that from a really bad diet. You get that from eating too much bread, too much tortillas, too much sugar. Because sugar, we don't need sugar. That's the one thing we don't need in our body.
Fast, or no?
It happens over time. So now, like when somebody is overweight from eating too much carbs,
You don't get me.
too much carbs, what happens is that the fat doesn't just get stored in, like around your belly and around your organs. It gets stored everywhere, even inside your vessels. And when that happens here, that's when it's a problem.
Oh, so that's what that white area was.
It's stored fat, yeah, and the stored fat. So that's why like a lot of people that have diabetes, they have diabetes because they eat so much bread, tortillas, sugars. They'll eventually, not for sure, but there's a good chance they're gonna have this because all this is fat from eating too much carbs. And that's the problem with diabetics. You're diabetic because you eat too much carbs. So you're showing too much sugar. You're making too much sugar in your body, and you're already eating sugar that's already made. So you're like really shocking your system. Your pancreas can't make enough insulin, and so it just stores that sugar as fat. Fat is stored sugar. That's all fat is. It's just too much sugar, but your body makes sugar when you eat bread. It makes its own sugar. So you don't even need to eat sugar. That's the one thing we don't even need in the body. Okay, just so you guys know. Any questions about any of this stuff? Okay, so we went over the physiology, how it normally works, and then we went over a heart attack, what that patient was having, okay? And the heart attack happens when there's a clot in the coronary arteries. The coronary arteries feed the heart itself. That's why the heart gets fed, okay, as the aorta is leaving. So what I'm gonna do now is we gotta take a picture of this, go ahead, and then I'm gonna show you guys a real oversimplified video that's gonna hopefully make this easier in case you guys had issues with my lecture. Okay, let me. That's pretty cool, right? Easy. That's what I mean.